Now that 2025 is up and rolling, we can finally get down to some real Medicare business and talk about directly some of the Medicare plans that are out there that don't always get as much attention, but are still some really great options for folks whose healthcare needs and their healthcare goals fall within line of the benefits that are offered. So today, we're going to be talking about a relatively small plan, I guess, as far as Medicare Advantage plans go, that I think is going to have some great options for clients with very specific healthcare goals, and that is the Anthem Blue Cross Prime Plan for San Diego County in 2025 for all of you San Diegans out there, including me. Hi, I'm Michael, and this is Michael's Medicare. And if you or somebody you know is trying to figure out what is that best Medicare option for them during the AP or really all year round, give us a call at the information down below and we can help them to make those tough Medicare choices. Oh, and don't forget to like and subscribe. So just as a refresher, if you haven't been keeping up on the newest Medicare news, which I'm sure you all do if you're watching this, but AP is over, okay? And everybody knows that. But now it is still time for the GEPP, which means that folks will have a one-time option to change to a different Medicare plan if the Medicare plan that they chose during the AP, well, it's just not working out for you. So there is that, and there are still a huge number of folks in these 3 months who are going to become eligible for Medicare for the very first time. And then there are those folks who maybe missed enrollment in Medicare back when they initially could and are now, January through March that is, able to hop back into original Medicare and then ultimately choose another Medicare plan. This means cumulatively, there is still a huge amount of folks who are going to be looking at Medicare health plans, and this is why today we are going to be covering one of those plans that is available in San Diego in 2025, the Anthem Prime Plan. First up for the Anthem Prime Plan is a benefit that pretty much 100% of our clients love, and really the more of this benefit, the better, right? But either way, it is the Part B premium reduction. What this is essentially a Medicare Advantage plan, in this case Anthem, is reimbursing, is paying for some or a part of Medicare Part B enrollment costs. And if you haven't seen it yet or noticed it, that the Medicare Part B cost in 2025 has gone up to $185 a month. On this Anthem plan, it will have a monthly reimbursement rate of $17 per month. So, you know, it's not going to cover a huge portion. It's not going to cover all of that Medicare Part B cost, but it is still $17 back into one's pocket. So really, it is more Anthem buying you a couple of extra cups of coffee every single month rather than paying for your Part B. But you know, it's not life-changing, but it's okay too. And if anyone has a Starbucks habit like I do, you can just know how expensive that coffee habit can be. Another really big benefit that maybe is less flashy than Anthem putting money back into somebody's pocket, but may actually end up being a lot more savings, is going to be the comprehensive dental coverage that is included on the Anthem plan. This is because automatically on the Anthem plan, there will be a yearly dental allowance of $1,500 that can be used towards comprehensive dental services. This is going to be in addition to all the preventative and cleanings and x-rays kinds of things. The difference is basically that the standard cleaning, again, x-rays and fluoride treatment, and maybe just kind of someone to look at your teeth, that would all be considered preventative. That stuff is usually covered by any plan that offers dental coverage, the basic one. But where things get costly, as anybody with finicky teeth will know, is for those comprehensive services. So root canals and bridges and implants, dentures, and the like can get real expensive real quick. But under the Anthem plan, they will pay $1,500 a year for those services, and then any cost over that, though, will still be at the cost of the beneficiary, at least until next year, where it all resets. Next up, let's talk about some of the core coverage elements of the Anthem plan, which is the deductible and doctor's visits cost. Now, you know, that is going to be the real meat and potatoes of a Medicare plan. First up is going to be for the deductible, which for insurance is the initial amount of money that a beneficiary has to pay before the insurance plan starts to help pay for those costs. For just original Medicare, so folks who have just Medicare Part A and Part B, there is a yearly Part B deductible of $257 in 2025 that has to be paid first before they start helping pay those costs on Medicare Part B only. That is, of course, if they don't have any additional plan. But when someone does have the Anthem plan, there actually is not going to be a deductible. So from the very first healthcare usage of the plan, there will be no upfront costs that have to be paid first. Next, to keep things very simple, and this makes things very simple, is going to be the copays or set payments per usage to go see a doctor or a specialist. And on the Anthem Prime plan, assuming those doctors or specialists are in network, the cost to go see a specialist or a primary care doctor, a PCP, is $0. So that's pretty easy. Another one of the benefit tentpoles a Medicare health plan is going to have is called the maximum out-of-pocket cost or MOOP. And this is a limit on the total Medicare spending, meaning things like the cost for doctors and copays and coinsurances, for doctor's visits, specialist visits, hospitalizations, etc., but it does not include prescription drug costs. So all the medical costs excluding prescription drug costs. The limit on the Anthem plan is $2,000 per year. That is the most that a Medicare beneficiary enrolled in this plan will pay for their medical services for the year, which I would say is not the highest out there, but it's also not anywhere close to the lowest out there. It's sort of like one of the most mediumist ones. That being said, in 2025, there's also a limit on the potential prescription drug spending, which is $2,000. So hypothetically, the most that someone could spend on their medical and prescription drug costs in the year would be $2,000 for the medical, that's the MOOP, and $2,000 for the prescription. Put those together, $4,000 per year. So not too bad as an ultimate stop loss, I guess, in the grand scheme of things. That's pretty good if you were comparing to what it would be if you didn't have a Medicare health plan. And last up today, let's talk about drug costs on the Anthem plan here in San Diego, because this plan does include prescription drug coverage, or otherwise would be covered under a standalone Part D, but they're all put together, so it's an MAPD, and it's automatically included on this plan. It doesn't have a specific drug deductible, and it'll have medications at all of the tier levels. Tier 1 medications, which are preferred generic medications, will have a copay of $0 for a 1-month supply, whether that is at a retailer or through the mail. Same goes for the Tier 2 drug, but when someone does get to Tier 3 medications, there is a coinsurance or percentage of cost of either 15% or 20% of the cost of that medication, depending on where somebody gets the prescription filled. Tier 4 is going to be a 25% co-insurance or cost to the Medicare beneficiary, and Tier 5 drugs are at 33%. Also in 2025, there is a specific cost cap on insulin at $35, regardless of the tier of the category that they are in. So there you have it, the Anthem plan for San Diego in 2025. And of course, I think this is a plan that is very good for folks who have healthcare needs and goals that fit within the cost and benefits that are covered here, but also the doctor's networks and the prescription medications available on the plan. Because remember, the costs are just one portion of a Medicare triad, which is doctors, medications, and costs. But those are a bit more person specific and should be explored before someone enrolls really into this plan or any other health plan that's out there. But if you or somebody you know is trying to figure out what is that best Medicare health plan that has their doctors, their medications, and their costs right where they want and need them, please feel free to reach out to us at the information down below, and me or one of my team will be happy to help them over the phone or in person at one of our many offices across Southern California in English or Espanol. So for Michael's Medicare, of course, I am Michael, hoping that you all have a great rest of your day, and goodbye.